So Dr. Rohit, can we start?
Yeah. Okay. So we have 15
Yeah, okay.
participants as yet. Uh,
Yeah,
so I'll go slow.
yeah.
Do we have to? Are we doing the translation as well as I speak?
Yes, sir. Sir, I'm going to introduce you to all the participants. Then I'm going to introduce the translator. We have our translator, Yaovi, over here also.
All right.
Okay.
So a very good evening, everyone, from here in Gurgaon, India. Uh, this is Dr. Rohit Lamba. I'm a consultant orthopedic and joint replacement surgeon. And today, this evening, we are sitting here to discuss a few things about what all comes in the purview of orthopedics, what all patients we get to see, how we manage them, and what all we can offer them in terms of their treatment here in India.
Bonjour à
So,
tous et
can we get on to the
bienvenue.
next slide?
Bon-
Dr. Rohit, can you please pause within some intervals so that Yaovi can translate what you are saying?
All right, okay.
Yeah.
bonjour
Yaovi,
à,
you translate.
bonjour à tous et bienvenue à cette réunion où nous allons parler de l'orthopédie. Je suis Dr. Rohit Lambda, consultant en orthopédie et nous allons voir les différents aspects de l'orthopédie et les traitements qu'on peut y apporter.
All right, so next slide, please. So these are the few places where I worked at. I think we'll skip the slides in and go to the next one and then the next one. We've gone back.
So wait a minute, let me
Let's
check.
go forward.
Yeah.
Uh-huh.
Sir, is this the right slide? Can you please check once?
We can move forward, move on to the next one. We can move on to the next one. These are a few places where I worked at and gained experience in the field of orthopedics and joint replacement. Let's go on to the next one, please. These are a few people I've worked with and gained much experience. Next one, please. Let's go on to the next. Okay, for those of you who are wondering what is new in the field of joint replacement, this is a computer navigation system. Yeah, you can speak.
Pour ceux d'entre vous qui se demandent les nouvelles innovations dans le domaine de l'orthopédie, voici une machine d'intervention.
All right, next slide, please. So what it does is, this is the information that we get when we are doing a joint replacement surgery in terms of how is the alignment of the joint, how much of the bone we have to cut, and how we place the implant that goes inside. You see how we?
Voici les informations qu'on obtient quand on essaie de faire une opération en orthopédie. Ça montre le niveau de l'os, les endroits à réparer et les implants à y mettre.
Next slide, please. Again, another view of what information we are getting. These numbers are helping me give the best alignment to the knee and the best position of the implant. Yes,
Encore une
Yavi?
fois, ces informations nous permettent d'avoir une meilleure coordination des données que nous avons et un meilleur placement du genou.
All right, next slide. Again, next. This is how we are registering the landmarks of the knee when we are doing a knee replacement with computer navigation. This is just a small video of that. Next slide. Next again. Again, this is a robotic system which provides pretty much the same thing and also helps in the robotic arm actually goes in and cuts the bone to do the major part of the surgery. Yes, Yavi?
C'est une machine robotique qui aide dans l'opération et qui aide aussi dans le découpage des tissus directement.
Next. It is also giving with these images, it is also giving me an information as to what exactly I have to do, and the plan for the surgery is made even before the surgery begins with the help of the CT scan of the knee, which goes into the system and plans well ahead in terms of how to cut the bone and how to place the implant. Yes, Yavi.
Cela aide aussi pour l'élaboration du plan d'action, vu que ça donne des informations sur l'emplacement du genou et les différents endroits où on peut procéder aux réparations.
Okay, Yavi, I would like that if at any point someone has a question, they can stop therein and ask a little bit. That if someone is if there is a problem understanding, I will be happy to give answer at the at that time only.
Si quelqu'un a une question, vous pouvez m'arrêter à tout moment et poser la question.
All right. So next slide. So this is the system that we use here in our hospital, and this is a Striker Mako system, which provides us the best quality in terms of the in technology in robotic surgeries.
C'est la machine que nous utilisons dans notre hôpital et ça donne la meilleure qualité en termes de données et en termes de robotique.
Next. Okay, again next. Again next. So this, if you can see, this is a kind of arthritis. This is a kind of patient who requires a robotic or a computer navigation system, because if you can see on the left side, the bone is there is a severe arthritis in the knee, and the bone has a old fracture slightly above the knee, which cannot allow normal instruments to be used during the surgery. So in this case, we have to use a robot or a computer navigation system. Is Yavi?
Encore ici, nous pouvons voir que cette fracture ne peut pas se traiter avec une intervention normale. Donc, ce sont des cas dans lesquels l'utilisation d'un appareil robotique est requis.
So next. This is again another view. You can see the bone is crooked, and the at the place there it was fractured, it is united in the wrong position. So that makes it all the more difficult to do it with normal instruments.
Nous pouvons voir ici que la fracture a entraîné une déformation de l'emplacement de l'os. Donc, l'intervention d'une machine robotique est requise pour ce traitement.
Next. So this is what comes out. You can see we have been able to do this procedure with the basic implants and no special implants, just with the help of the robotic system that we had. Next. This is a post-surgery X-ray. You can see the knee is totally straight and perfectly well balanced. Yes, Yawi.
Ceci est une image qui a été prise après l'opération. Nous pouvons voir que le genou est bien positionné.
Again, another patient who had a similar problem. You might see a lot of patients of rheumatoid arthritis, which I believe is very prevalent in African countries. If someone has experience with that, you can please let me know. Rheumatoid arthritis is an inflammatory kind of arthritis in which the knee gets damaged due to the immunity of the own immunity of the patient, and in that case, the whole cartilage is lost. And in such case, even in very young patients, even in very young patients, we have to do surgery sometimes. So this is one of those patients.
Voici un des cas les plus fréquents en Afrique et on peut voir la fracture et si vous avez des cas de ce genre, vous pouvez en parler.
Next. So these patients sometimes require special implants. As you can see, this patient has a knee implant which has a rod going down into the leg bone on both the sides because the bone was very weak due to use of steroids. Yes, Yawi?
Ce patient a besoin d'un implant parce que le genou a été affaibli à cause des stéroïdes.
Next. She went back very happy. The next patient. Next slide. Again, this patient is again an African patient from East Africa, and he had a gunshot injury because of which he had a crooked knee and it got severe arthritis. Now he also has total stiffness. The knee did not bend at all. Yawi?
C'est un patient qui nous est venu de l'Afrique de l'Est qui avait euh, un problème à cause d'une fusillade. Donc, nous avons dû traiter ce patient.
Next. Next again. So this again required special implants and special computer navigation system so as to help us in doing this surgery successfully. And this is the outcome after surgery.
Ceci aussi nécessite un implant spécial, donc l'utilisation de, d'un équipage robotique. Et voici le résultat après l'opération.
Next slide. You can click on this. This is a video. This is him walking 3 weeks after the surgery without any support. So you can
Là,
see he's a young guy and he's walking comfortably.
Là, vous pouvez voir le patient qui arrive à marcher normalement à peine 3 semaines après l'opération et vous pouvez voir qu'il marche normalement sans gêne.
Next. This is another patient with a stiff knee, not bending, and again had a fracture because of which he had arthritis. Next slide.
Aussi un autre patient avec le genou qui ne se plie pas et qui a aussi de l'arthrose.
So you can see here, this is how it was. Because of the fracture and not uniting well, this has developed severe arthritis. Next slide. This again required special techniques and implants, and with the help of the robot, we were able to do this surgery very comfortably with very good outcome, and he started walking and bending his knee comfortably.
Vous pouvez voir avec l'utilisation du robot, nous avons été en mesure de traiter et le patient a pu se déplacer normalement.
Again, another patient, very obese, uh, very fatty legs, and very bad deformity of the knee with severe arthritis.
Un autre patient avec une condition d'obésité avancée et des genoux qui étaient en mauvais état, comme vous pouvez le voir.
Next. You can see the knees. You can see the X-rays on the right side. It is so bad that the almost 30% of the bone was lost because of the damage, because of the arthritis. Next one.
On peut voir que plus de 30% du genou était endommagé à cause de l'arthrose.
This again, after the surgery, nice reconstruction, legs are totally straight, and now she is able to stand and walk.
Après l'opération, on peut voir que la reconstruction a été parfaite et les pieds sont bien droits et elle peut marcher normalement.
Next. We can skip this. I think we've seen enough of knee cases. Go forward. So this, if you can, okay. So this, if you can just click on the video, this is a gentleman had knee surgery, knee replacement, and 2 weeks after the surgery, he's walking comfortably, even without using a stick. You can just click on the video if you can.
Vous pouvez voir dans cette vidéo un homme qui, après 2 semaines, qui 2 semaines après l'opération, a pu marcher normalement sans l'aide de sa canne, comme vous pouvez le voir.
So just go back to the last slide. I would just want to add a few things for the sake of our education, that knee arthritis can happen due to number of causes. Yeah, you can just translate.
Je veux juste préciser que ceci peut être dû à plusieurs facteurs.
Most common is osteoarthritis, which happens with old age.
Le plus commun, c'est l'ostéoporose qui vient avec un âge avancé.
Then the other kind is rheumatoid arthritis, which is an inflammatory arthritis and can affect very young patients also.
L'autre, c'est l'arthrose inflammatoire qui peut toucher aussi des jeunes patients.
The third kind, the third kind is arthritis happening after a fracture or an injury.
Le troisième cas est l'arthrose qui survient après une blessure.
Do we have a question here?
Est-ce que quelqu'un a une question ici?
No, sir. You can continue.
Yeah, I thought someone was asking something. Okay, and another kind of arthritis is when it happens in case of gout. So gout is a condition in which there is high uric acid in the blood, which causes inflammation in the joints.
L'autre cas peut être lié à une complication liée au sang.
So if you have to evaluate patients with knee arthritis, you have to get first of all their routine blood tests and inflammatory markers like ESR, CRP, and anti-CCP.
Si vous devez évaluer un patient atteint de l'arthrose du genou, vous devez consulter leur examen sanguin pour pouvoir faire le diagnostic.
Then, then comes the imaging. So we do X-rays of the knee in standing position because that tells us in the best way possible what is the condition of the cartilage of the joint. So X-rays of the knee in standing position.
Ensuite, nous procédons à la radiographie du genou en position debout et cela nous permet de comprendre un peu plus la situation du genou.
So the early cases can be treated sometimes with exercises like physiotherapy, and in certain cases, then you need special cartilage restoration procedures like viscosupplementation, in which you give an injection inside the joint, or a platelet-rich plasma injection.
Les cas du début peuvent être traités avec des exercices physiques ou des injections.
Okay, so let's go on to the next slide. Now we start with some hip cases. Now this patient has avascular necrosis, which is very common in Africa as well. Avascular necrosis can happen due to two causes. The major ones that I'm talking about, one is steroid usage, which happened a lot during COVID. The other is sickle cell disease.
Ici, nous parlons maintenant de la hanche et nous voyons ici un cas qui peut être dû à la nécrosis avasculaire qui touche beaucoup de patients et qui a été beaucoup plus répandu à cause du corona.
So all of these patients, they start off having first pain and the X-ray is normal. Only if you get an MRI scan, you get to know that they have avascular necrosis. Uh, so yeah, Yavi.
Tous ces patients ont commencé à avoir des douleurs, mais leur examen initial ne montre rien. Donc, il faudrait procéder à des examens plus poussés pour déceler la cause.
In early cases, like in stage 1 and stage 2, sometimes we can manage it with medications or a small procedure called core decompression and stem cell grafting.
Dans les cas mineurs, nous pouvons procéder avec un traitement par médicament ou une modification du mode de vie.
Late cases in advanced arthritis need a total hip replacement.
Les cas avancés nécessitent un remplacement de la hanche.
Like this patient, you can see, just click on the video please. This is how he walks because of the problem. Now see in the next slide how he is walking after the surgery. Next please. This is him having had hip replacement on both the sides at the same time, and then we go on to the video. Please click the video.
Nous pouvons voir ce patient qui, dans la vidéo précédente, avait du mal à marcher à cause de ce problème de l'articulation au niveau de la hanche. Donc, après une opération de remplacement des articulations, vous voir qu'il marche normalement maintenant.
So this is how he is walking after the surgery, and that is how good the results can be.
Voilà le résultat qu'on peut obtenir avec ceci.
Next please. This is another condition which happens during childhood. You can see on the right side, the hip is not inside the socket.
C'est une condition qui touche l'enfance et vous pouvez voir que l'articulation n'est pas au bon endroit.
So because of that, come to the next slide please. The leg is short. Next slide. You can see the leg is short. Next slide.
Ceci peut entraîner une réduction du pied.
Video. And she walks with a limp. Next slide. Next. This requires a special technique and special implant in which you have to make a cut in the bone so that it comes at the level of the normal hip socket, and then you put a special implant inside.
Ceci nécessite une intervention où on doit couper l'os pour qu'elle soit adaptée à l'articulation et mettre un appareil qui pourra corriger le problème.
Next. This is her walking after the surgery, 1 week after the surgery, on video.
Voici la patiente en train de marcher une semaine après l'opération.
Next. And this is her walking 3 months after the surgery.
Et la voilà
She's
en train de
still gaining
marcher
strength.
normalement 3 semaines après l'opération.
Next. This is another such case, both sides. So this is known as DDH, developmental dysplasia of the hip. The hip is out of socket since birth, and because of that, the patient is limping and then starts having pain later in the life.
Ceci est une condition connue sous l'acronyme de DDH qui résulte du fait que la hanche soit en dehors de sa cavité, ce qui cause des douleurs aux patients en grandissant.
Next. This is the X-ray. After the surgery, this is how we do it. This is how the implant goes in. Again, the same special technique, and the patient starts walking.
Voici l'image qu'on a après l'opération, après avoir mis les implants et avoir permis aux patients de bien marcher normalement.
Next. Again, similar case, but this time the hip is just at the edge and not gone completely out. But because of that, developed arthritis. Next. Let's skip through the slides quickly. Again, hip arthritis, hip replacement, doing very well after the surgery. Next. Next. Okay, this is again a very special case. This is something which you see over there. This is hip arthritis, both hips, because of sickle cell disease.
Ceci est un cas spécial, c'est une arthrose de la hanche qui est due à une maladie.
So sickle cell disease causes avascular necrosis of the hips because it blocks the blood vessels of the hip.
Ceci est causé par la nécrose qui bloque l'articulation de la hanche.
So again, this patient requires very special techniques and
Ce patient a besoin de techniques spéciales.
let me just get back to this. I have been interrupted in between. All right. So sorry, I was interrupted in between. This patient requires special evaluation because of sickle cell disease. It is not safe to do a surgery just like that. First of all, we have to reduce the number of sickle cell hemoglobin in his blood by exchange blood transfusion.
Ce patient a besoin d'une intervention particulière. Nous devons d'abord réduire le nombre de globules dans son sang par transfusion sanguine.
So after this, we can safely do the surgery one side at a time, like in this case. Next slide.
Après cela, nous pouvons procéder à l'opération.
So after many years, he was able to stand and walk, and he was very happy going back home.
Après plusieurs années, il a été finalement capable de marcher normalement. Il était content de rentrer chez lui.
This again, hip arthritis due to a problem in childhood, which was Perthes disease. So you must have seen a lot of patients in your own practice also who develop Perthes disease, which is a disease which happens around 8 to 10 years of age because of damage to the blood supply of the hip bone.
Ceci est une arthrite de la hanche qui est due à une maladie contractée dans l'enfance aux alentours de 8 ans. Et ceci est souvent la cause de ce type d'arthrite.
So this patient, very young, only 18 years of age, but because of Perthes, he was having this problem since last 8 years and not able to walk. Now see him after the surgery. Next slide. This is after very well done hip replacement surgery. Now see the next slide. This is him sitting cross-legged, squatting, and even sitting down to offer namaz as they do.
Ceci est un jeune patient de 18 ans qui souffrait de ce mal depuis plus de 8 ans et vous pouvez le voir sur les différentes diapositives, la réparation de sa hanche et vous pouvez voir qu'il n'a pas du mal à s'asseoir ou à s'accroupir ou à se mettre dans n'importe quelle position après l'opération.
Next. I think this is a very complex case. We can skip this. This is a case of revision hip surgery. We can skip this. We can talk about something simpler. Let's go ahead. Keep skipping. This is a revision surgery. Skip. Same patient after surgery. This is a patient with injury to the ligament of the knee. You can just click this video. Because of ligament injury, the knee becomes loose and it is moving in front and back.
Vous pouvez voir un patient qui a des problèmes avec les ligaments du genou et vous pouvez voir que le genou se déplace anormalement.
Next. So for such patients, we need an MRI scan to see how the ligament is and the other structures, which is the meniscus, which is a shock absorber inside the joint.
Pour ceci, nous avons besoin d'une IRM pour comprendre comment les ligaments sont et ce qu'il faudrait en faire.
Next. So you can see on the left side, this is the graft that has been prepared, the artificial graft, which is prepared from the patient's own body. And this is the one which is going to go inside the knee and make the new ligament.
Vous pouvez voir sur l'image à gauche la greffe qui a été préparée et qui va être utilisée pour l'opération.
Next. Next, this is the same graft that we used, tendon graft. This is an artificial graft material, which is something which we can use when patients have more than one ligament reconstruction to be done. So if there are 2 or 3 ligaments to be made and we don't have options to take graft from the patient's body, we can use this artificial graft material.
Si nous avons plusieurs implants à faire, plusieurs greffes à faire et que nous ne pouvons pas tous les prélever du corps du patient, nous pouvons utiliser cette greffe artificielle.
Next. This again, now there will be some cases you can see what happens during a fracture. If it is not fixed well, then it goes into non-union, and because the fracture was not united, even the implant break.
Ceci, vous pouvez voir si l'opération n'a pas été bien faite, la personne ne pourra pas bien se tenir.
Next. Next. This is how we manage this. We took out the old implant, put this long rod inside, and put some bone graft.
Donc, vous pouvez voir, nous avons retiré l'ancien implant et nous en avons mis une autre.
Next. Next. This was another patient. Again, all these patients which I'm showing are from Africa only. This was again another patient with bone infection. So he had a fracture and he also developed infection in the bone.
C'est un autre patient et tous ces patients que je montre sont africains et ceci est dû à une infection de l'os qui a suivi une fracture.
Next. So this is how we managed it. We took out all the dead bone. You can see there is a huge gap there because we've taken out all the dead bone. Until you take out the dead bone, it is still going to keep causing infection. And then we applied this fixator with which we are making the new bone.
Donc, pour ce faire, nous avons retiré tous les anciens os qui causaient l'infection et nous avons utilisé cette machine pour reconstruire de nouvelles os.
Next. Next. Click again. Ciao. So this patient came with a blast injury affecting his elbow. The hand was already amputated at the time of injury, and he had a very bad shattered elbow. Which next slide, please. So we had to go in and put a fixator first, do a flap cover to cover the bone, to cover the wounds, and then next stage we did a fusion of the elbow. Next.
Donc, c'est un patient qui a eu une blessure par explosion. Donc, nous avons procédé comme vous pouvez le voir.
Video. This you can see is how an artificial prosthesis is allowing him to hold the pen and actually write. So even
Donc,
after such bad injury, he was still able to get back to even writing.
Donc, vous pouvez voir qu'après l'opération où nous avons placé une prothèse artificielle, le patient était en mesure d'utiliser sa main et d'écrire normalement.
Next. One more case. This is you also may be getting such injuries in war injuries or in cases of blasts or accidents. Sometimes a large part of the bone is lost, like in this case.
Vous pouvez voir aussi sur des accidents, des blessures de guerre, une grande partie de l'os peut être perdue.
This is how we reconstruct with the help of a fixator by distraction osteogenesis. You can see the next slide. You can see we have been able to make the whole bone with this fixator, and he was able to stand on it and start walking and do all of his work afterwards.
Vous pouvez voir que nous avons été capables de reconstruire l'os en entier grâce à ce fixateur et le patient a été en mesure de se tenir debout et de marcher normalement après ça.
Next. I think this is the one final case in which you can see in certain cases in children, because of vitamin D deficiency, sometimes you can develop a knock knees, which is known as genu valgum. So knock knees, if not treated at the right time, can cause this deformity because of vitamin D deficiency, and then you have to end up doing a surgery.
On peut voir, à cause d'une déficience, certains patients peuvent présenter ce type de genou et si cela n'est pas traité à temps, ça peut nécessiter une intervention chirurgicale.
This is this X-ray before the surgery. Next slide. And this is after the surgery.
Donc, c'était les images de scan avant et après l'opération.
Next. Click and click. So you can see from here to here, this is how the knees got straight.
On pouvait voir comment le genou a été redressé après l'opération.
Thank you for a patient hearing. I'll be open for some questions now.
Merci et vous pouvez poser vos questions maintenant.
So, hi everyone. If you have questions with Dr. Rohit, you can post them in the chat.
Si vous avez des questions pour le Dr. Rohit, vous pouvez les mettre dans l'espace de messages et nous y répondrons.
So Dr. Rohit, there is one question in the
So as I
chat.
said, there is a question, yeah, which group of patients hip replacement surgery is indicated? So broadly, I will give you different categories. One is when there is congenital deformity, like I showed, DDH, when the hip is out of the socket. Yao, you can keep translating as I stop.
D'accord. Donc, la question demande à quel type de patient une opération de remplacement de la hanche est nécessaire. Donc, la première catégorie, c'est euh, les troubles congénitaux.
Then the other one is when during early childhood, if some patient develops infection of the hip or Perthes disease or a problem in which the hip epiphysis displaces and it causes abnormal shape of the hip. Such patients can also develop arthritis later on and finally need a hip replacement.
L'autre cas, c'est au cas où il y a des infections par rapport au niveau de la hanche qui sont développées dans l'enfance. Cela peut aboutir à une déformation de la hanche qui peut nécessiter aussi une intervention chirurgicale.
Then in early adulthood, sometimes patients with avascular necrosis in advanced stage, they have arthritis and they can require a hip replacement again.
Et à l'âge adulte aussi, des patients qui développent de l'arthrite peuvent aussi nécessiter une intervention chirurgicale.
And one more category would be patients who have had fracture around the hip and due to some reason the fracture has not united well, it has united in the wrong position maybe and caused arthritis and causing pain. So this is another category who requires hip replacement.
Une autre catégorie, c'est au cas où des patients ont eu l'arthrite qui a endommagé la hanche et la réparation n'a pas été bien faite. Donc, cela peut entraîner d'autres complications qui peuvent nécessiter une intervention chirurgicale.
Right. So
If anyone has any more question, you can put in the chat box.
Hello. Hello.
hello.
Hello.
Yeah. Thank you for the presentation. I'm very pleased with your presentation. You said, based on what you presented, is there any definitive treatment for arthritis currently? Definitive.
Sir, if we are talking about arthritis, are you talking about rheumatoid arthritis?
Sir, I think there is some network issue from his end.
Mm-hmm. So, should I? Okay, I'll just answer the question anyways. So,
Okay.
if he was talking about rheumatoid arthritis, the definitive treatment in the early stage until we have developed cartilage damage, until that has not happened, we can manage very well with medications. So there are disease modifying anti-rheumatic drugs which are known as DMARDs, which are available to treat this problem. In certain cases which do not respond well to this, we can use special biological uh, disease modifying drugs which work very well, but these has to be done after complete evaluation by the orthopedic surgeon or the rheumatologist, and after that only these medicines can be started. Then if you're talking about patients who have arthritis and the cartilage is already damaged, in that case the definitive treatment is hip replacement. When we do that with the implants that we do, the implants that we use, we can safely say that the patient can be pain free and active and doing almost all of his activities for the next 30 to 35 years. So that's how long the implants of hip replacement can last nowadays.
À la question de savoir si l'athlète peut être traité définitivement, cela dépend de l'état du cartilage. Si le cartilage n'est pas totalement endommagé, le traitement peut se faire par médication ou par des médicaments qui modifient la structure cellulaire. Mais au cas où le cartilage est endommagé, il est nécessaire de procéder à une intervention chirurgicale pour remplacer la hanche, l'articulation de la hanche.
So, Dr. Rohit, we can, if I get more questions, any more questions from anyone, I will club them and I'll share them with you
All right.
and end this meeting here. Thank you so much, Dr. Rohit, for your time. This was a very insightful session by you.
Thank you. Thank you. Hope
So
we
much,
could
Dr.
connect with a lot of people. And if there's any further questions, I'd definitely love to connect again. We can have more such interactions in the future.
Yeah, sure.
And maybe we can also create a WhatsApp group of all the participants where they can put in their questions and connect for all further queries also in terms of their patients. If they have any queries regarding their patient, they can get in touch for management purposes as well.
Yeah, sure, Dr. Rohit.
Merci
Okay,
à
thank you.
tous et nous pouvons avoir des groupes ou des espaces de discussion où vous pouvez poser des questions si vous avez des patients avec des situations spécifiques ou les partager pour des conseils et autres. Merci à tous.
Thank you, Dr. Rohit. Thank you so much, Yavi, for translating.
Thank you, Yavi.
Yeah, thank you everyone for attending.
Thanks everyone.